Hello everyone, I'm Manny. I just wanted to talk you through this intrapartum assessment tool and hopefully make it a little bit more clear and easier to use. First of all, why do we need this tool? Well, other than continuously trying to improve the care we are proudly providing to our women, the latest version of Saving Babies' Lives is referring to a more holistic approach to intrapartum care. We will now need to provide evidence of documented reviews of both fetal and maternal well-being on an hourly basis. Also, NHS England are anticipating to introduce a new tool which hasn't been piloted yet. I'm referring to the ABC tool from Oxford, and Imperial are meant to be a trial centre. The tool that we're going to be talking about now has come through this ABC tool. That's what it's based on. So hopefully once the ABC trial starts, we won't have new big changes to implement in the care and documentation. And finally, the purpose of this tool is to provide an instant overview of all significant features and help with an assessment or even the escalation of any concerns intrapartumly. So the tool is named Holistic Intrapartum Assessment Tool. As you can see, it has some basic identifiers as the patient sticker on the top left, as well as a timeline of gestation, of labour and date time of using the tool. Then all the parameters that we will be showing, they have an hourly timetable. This does not mean that you need to perform these assessments on an hourly basis. You perform them as per normal practice and document them in the relevant box. Then, as we progress through labour, one would be able to see the story of the labour at a glance in a timetable format. So first is the NEOS score. Here we would be entering the final score of the observations we took. We would still need to enter the full set of observations as normal on Cerner. I just wanted to point out here that obviously at this trial stage there will be some duplication of documentation on the tool and on Cerner. So the idea is, however, that if we find this useful, we could transfer it on a dashboard type on Cerner. And from preliminary talks with the team, it seems like this should be possible. So when this gets integrated to Cerner, then the duplication would stop. Moving on, we have the partogram with all the features that we know, and we have just added the fluid intake monitoring at the bottom following some recent cases so that we can have a better overview of the case. Obviously this would not be an hourly assessment, as I mentioned before. You do the assessments as indicated and document them in the relevant box. This then provides an overview at a glance. Then we have the fetal heart monitoring. Here you are just meant to tick the classification of the CTG or intermittent auscultation. And just to mention, the fresh eyes and CTG still need to be documented on Cerner as they normally have been so far. And then the main new feature coming in this tool is the risk factors cumulative score. So you will have on the side of the paper a risk factor table where most will be known before the onset of labour, and at the bottom there are some intrapartum risk factors. The idea is we score the risks at the start of labour, and then if we see as labour progresses that the risk factors are increasing, then that would be a prompt to escalate for review. Obviously we have to have a sensible assessment based on the risk factors, as it would be a different case if you had two risk factors of GBS positive and asthmatic versus VBAC and PT. So we haven't structured as such yet any restrictions for the risk factors or actions to be taken. The idea is that they act as a prompt for escalation. And just as a point, when and if this gets into Cerner, if we have entered these risk factors antenatally in a correct way, then Cerner would be able to auto-populate these when you go into the tool, or at least that is the idea. And then it will make documentation as well as data collection for audits research a million times easier. And at this stage we have it in a paper format, as I said, so we have it on a double-sided sheet and it covers a 24-hour period. So one side is 0 to 12 hours and the other side is 13 to 24 hours. Hopefully this can help other than just providing care, but it might be a useful tool for handovers, or in case of an emergency someone can have a look at the sheet and get a summary at a glance of where we are and what has been happening so far. That's all from me. This is just a link and a QR code if you would like to provide an opinion about the tool. You don't have to have used the tool to provide this opinion. It's just based on what we've just said and how we've explained it. You can either use the link provided, or even easier, if you've got your phone, you can scan the QR code and it will take you directly to the questionnaire. We are collecting the responses to this questionnaire through the safety improvement team via the medical director's office, so we'll get all the data together and see what people think about it. Thank you again for your attention. Hopefully it was useful. Thank you very much.